Butaina, I think you're muted.
Sorry. Hello, everybody. Happy to have you today. I'm Buthaina Osama. I'm the SIDEVNet Middle East and North Africa Regional Coordinator. Uh, we are having today Donatella Bayero celebrating the World Mental Health Day. Donatella Bayero is the MSF's clinical psychologist who has 2 decades of experience working in some of the most challenging contexts in the world, specialized in trauma recovery. She is now focusing on the well-being of MSF Switzerland staff, whether in the headquarters or in the field. Donatella,
Hello.
can you hear me?
Yeah, I can hear you better now.
Better. Okay.
Yeah,
We are very happy to have you today, Donatella,
thank you.
celebrating the Mental Health Day. Let's start our questions with why it's important actually to provide mental health or mental care for people like health workers or humanitarian workers in the field, even to the journalists who work in the front lines. Why it's important?
Yeah, because we are talking about people that are used to work in a complex environment that expose them to a high level of stress and potentially also traumatic events. People that can be often socially and emotionally isolated. And researchers are showing us that the build-up of stressful experiences and trauma can show a link on with depression, anxiety, burnout, and bad coping mechanism behaviors. So it is important to address all these topics in order to create a better and healthier environment for them to work, or a better response, let's say, to the
And
consequences of this environment.
And do you think this can affect how good they can deliver their work if they are mentally affected by the circumstances they are facing?
Yes, yes. On the long term, the exposure to these kind of situations, if actually there are repercussions, this can affect the quality of, first of all, the health of the people, and therefore also the quality of work they can do.
And we heard actually recently about moral distress, either in the media or even by mental health experts. What does this really mean?
So the moral distress is a term that defines a set of negative emotions that health providers, and here specifically we are talking about humanitarians, can experience in situation where they feel, if you want, what is right, but for whatever reason cannot follow the course of an action. So this can actually cause some tensions in the individuals and some discomfort towards the actions that they have to take compared to what they think they should be right to do.
And actually working in the field and dealing with hard circumstances, um, how this could be problematic if the person have this kind of moral distress.
Well,
How
it can
would this affect, as I said, would this affect the quality of the work he can do on his decision even?
well, this really depends on the circumstances. People can experience some moral distress, but being able to carry on as the best they work, it really depends how this moral distress, how the people can deal with this feeling, with this feeling being sometimes like in a trap. We can carry on working. It depends how we deal with it, and on the long term, if we can find a resolution for this moral distress. Sometimes we can understand why we are facing a certain dilemmas, like can be for our medical workers to choose, because we have a lack of means to choose who we address care first. So these things can affect the people, and then depends how the people are dealing. So we can have the moral distress that not necessarily is leading to heavy repercussions on the health of the people, therefore with their performances.
Can you tell us more about MSF activities to support and empower its field teams who are subjected to mental drain or work pressure as they are dealing with hard circumstances?
First of all, we give a space for this. So we have dedicated people that are actually taking care of the humanitarian workers. Uh, in MSF, anyway, in the section where I'm working, we prefer to shift on a concept more of general well-being and not really on mental health, because we want to talk about prevention. We want to talk about what is actually the well-being, what are the different components of the well-being of a person. And we just don't need psychologists to do that. We need multiple people that are working on that. And there is multiple factors. So we put the accent on the prevention, first of all, on the prevention. And the prevention is made again by different things. There's not just one thing that we can do and can prevent everything. And sometimes is based on things that are very little. So for example, what we do concretely, we try as much as possible to discuss with everybody that is living for the field, and have a discussion around what do people usually put in place in order to take care of themselves. Are these instruments or these things available in a humanitarian environment? How people can recognize when the level of stress is reaching a limit that is not really under control. Can they recognize it? What they usually put in place in order to work in these extraordinary situations, and then to explain exactly where they can seek for support and care. This is all the prevention. In the prevention, we also put, as I said, in the general well-being, we try to discuss as much as possible of all the members of the teams with the different responsibilities that they can have in order to support and improve the general well-being of the people in the field. They are not just the medical people or the mental health professionals that can have an impact, a positive impact on that. And certainly there is also an individual responsibilities, but being aware of what we need in order to feel good, and this is definitely helping.
Perfect. Actually, in the last couple of years, um, most of the health workers around the world are facing the same situation that humanitarian workers used to work under. Um, what do you think is how to support them? How to do you think the health workers all around the world under the pandemic need this kind of mental support or mental care?
It is certainly good if they can have access to it. Not everybody needs a specialized support. Not everybody needs a psychological care. This is really, we talk about prevention, and then we can talk about access to specialized care. It would be good to have both in place. So to have to understand how we function, to understand what we need in order to function well, what we can do in case we are in an environment that doesn't allow us to have access to the things that normally make us feel good,
Better.
and how we work with the consequences of the stress, because sometimes we cannot tackle the sources of stress because are definitely bigger than us, but we can work on the consequences of stress, and then definitely try to give access to people to specialized care when is needed. And to arrive at this point, we have also to tackle what is mental health, what is the stigma, what are the barriers that prevent people to seek for help. In the past 2 years, I think so. You want to ask, I think, more about the COVID pandemic.
Yes,
And
exactly.
so in the humanitarian world, we always faces a situation, especially for a medical organization, where we lack of means sometimes and medical responses. At the beginning of the pandemic, anyway, the first wave had a big impact, like everywhere, not in terms of people affected in the field, but the fact that a lot of countries where the people were coming from were actually affected by the pandemic. And the COVID pandemic added a layer of complexity in an already very challenging work that we are doing. So the fact that the borders were closed, that the supply were not guaranteed, that the human resources turnover was not guaranteed. So certainly this had an impact on our work. And another difficulty was what the humanitarians at the beginning, where everything was pretty much unknown. We didn't know what we were dealing with. We lost, and not knowing means also that we lost a bit of control, and we didn't have all the answers. We couldn't foresee what was going to happen in 2 weeks, in 3 weeks. So some of the humanitarian workers could have felt a bit in a dilemma. Shall I stay in the field and carry on my work, or do I go home? And especially if I'm a medical person, I can go home where actually the pandemic is affecting my country. And people, especially at the beginning of the wave, didn't have much time to think about. They had really a short time because the airports were closing, the borders were closing, was quite challenging. Then, in the months after, we challenge other kind of we found other kind of challenges. As I mentioned, not having enough supply, not knowing what was going on, not having sometimes enough human resources, and that was taking the place of the people already in the field.
Okay. Actually, in the pandemic, also, many health workers face stigma. So, how do you think stigma against health workers have been? Um, do you have been witnessing cases of MSF teams who had this kind of stigma when, as you said,
Yeah.
returning home or back to their countries or even in the field?
Yes, stigma can be present when humanitarian workers are in working in an environment where a certain disease is present. We have to say that in this case, anyway, again, the coronavirus were more present in certain countries where certain expats were coming from, and not from the field. But if we think about anyway, people that are in contact with patients that could have COVID-19, or like we experienced also with the Ebola, what we have to try to do more with the Ebola, being honest with you, than with the COVID, also to brief the colleagues on how to deal with the family, for example, before going to the field. Give the family all the information available regarding a certain disease. And then, yeah, certain people came home and there were family members that didn't want to be in direct contact with them. Certain people reacted well, saying, okay, it's fine. My sister has young children and prefers to wait 2 weeks before I can hug them. And other people that suffer from that distance and stigma. But it's that I'm not aware of long-term repercussions about that.
And what kind of support do you give in such situations for the families and for the workers themselves?
Usually in this kind of situation, we do not provide any kind of support for the families, but in case there is a big problem, we can always discuss with the colleague and see if external people can support the family. What we do usually when the people coming back, anyway, for everybody, we propose a return talk where we try to discuss the potential difficulties that people can face once back home, normalize the situation. That doesn't mean banalize. Normalize means people need time to go back, need time to process what has happened, the experiences they have had in the field. So they need this buffer time and allow themselves also to have some difficulties. So in the normalization, usually we say, if you experience certain symptoms that decrease over time, do not worry. It's a normal process. We need time. Psychologically and emotionally, we need time to go back home. If the symptoms increase or tackle the functionality, at this point is where a professional support can take place. And this can cover many symptoms or many things, including feeling too stigmatized.
Actually, what is the best way to support this situation, both on organizational level and on team level? You spoke more about organizational level, but what about the teams themselves? How everybody could support each other in such hard situation? Is prevention or providing mental care all the times? How the team supports each other?
So prevention is the key. And there is a minority of people that actually can develop a symptomatology that requires professional support. So what we are trying to do is actually to have both available, to create a network, for example, of mental health professionals in the countries where we work that can provide the preventive and the curative side. How we do the prevention, for example, in the field can be translated in workshops, for example, in stress management. Discuss about what is mental health. Is prevention? It is mental health. It is well-being. So try to destigmatize the fact that to talk with a mental health professional means to be crazy, or to feel affected by certain circumstances means to be weak. Make an example. Important factor in the well-being of the humanitarian workers, but can be also the journalists, the people that are exposed to a very challenging environment, is keep an eye on your level of fatigue. Exhausted people are more vulnerable and potentially less reactive in a healthy way towards the challenges that they have doing this kind of work. So keeping an eye of your work hours, keeping an eye on your rest, on your vacations. Everybody can work beyond their capacities. This is undoubtedly, we all do. But for how long you do that? You do that for 3 weeks, you can do it. You do this for 6 months, probably you have to be careful. And for example, we discuss about the people in charge of human resources regarding these aspects. This is also sharing and taking different responsibilities and tackling different aspects of the well-being of the people. Work with the managers and the supervisors on how to create a good environment for the teams. Talking with the managers on, for example, the transparencies of the information. Be transparent, know what is going to happen with the program, with the movements. So being open to questions. Also, this can create a better working environment and potentially healthier. We have tried to understand where the sources of the stress are and try to minimize the ones that we can minimize. Because working in a humanitarian environment, there are sources of stress that we cannot actually tackle. So let's try to understand what we can work on in order to minimize the consequences on the health of the people.
Actually, as I said, in the last couple of years, because of the pandemic, most of the health workers are facing what the humanitarian work always face. At this particular time, could humanitarian workers help in taking care of ordinary health workers in countries which is facing high waves of pandemic?
At the beginning of the COVID-19, there has been this sharing of knowledge
Hmm.
with from the organizations like Médecins Sans Frontières that supported anyway health systems in countries that were facing this pandemic and in this kind of emergency. Our know-how in how to manage emergencies and also these let's say difficulties, potentially difficulties that people can experience at a psychological level. Also, we did support, but there is also a big know-how about stress management and distress. So, but we at the beginning we certainly try to help when asked.
Actually, before the our interview now, we have been in a quick chat, and you told me a very interesting sentence about how the pandemic changed many places to the same circumstances of conflict areas, which humanitarian workers usually used to work in. So
Yeah.
let's hear from you how this was tackled. How do you think this could affect the future of health workers in other parts of the world?
Well, for me, regarding what has happened, for example, in I can say Europe because I'm coming from Europe, and yeah, the scenarios that people were telling me, I didn't work directly in this kind in this response, but what people were explaining to me were reminding me what I have seen in the field many times, having outside the hospitals the triage areas, having unfortunately not enough bed to hospitalize everybody, have a shortage of means, of drugs, of oxygen. So making a choice. This has been certainly very difficult. I don't know to which extent has changed their practice because this is not my field. I have to say that for what concerning our experience in the field, unfortunately, there are things that we have seen before, and we in certain countries is our daily life and their daily working experience. I'm not sure I'm answering to your questions,
Yeah,
but
actually, what I was asking, how do you think this could affect the future of health workers? The pandemic itself, how hard it affected the mental health and of the health workers in different parts of the world.
I think that this depends on which kind of support they could receive and how they could process this experience. Not all let's say bad experiences, traumatic experiences actually are translated in symptomatology. It depends how people process this experience, how they can make it part of what or something that has happened from which we can learn, but they are not necessarily affect the functioning of the people in the future. They are not becoming pathological necessarily.
Um, Donatella, what is your piece of advice to groups of like reporters like myself working in the same condition where MSF field teams exist, like war zones, conflict zones, even natural disasters areas? What's your advice?
My,
How we take care of ourselves in such situations?
my advice is trying to understand how we usually function. What do you need to functioning well? And again, there are little things that pile up can have an impact on our general well-being. What is make you feel comfortable? What do you need? When I discuss with people before they leave to go to the field, I always ask this question: what do you put in your luggage to take care of yourself? And we can have a variety of answers that are depending on the number of people you ask to, because everybody is different. There are people that prefer to relax, people that prefer to be active, people that cook, people that read, people that dance, people that paint. Doesn't matter what you do. Try to understand what you need and try to understand if you can bring it with you. This is important. If you are going in an environment, for example, for a very sporty person, a runner who needs to run in order to process what is happening and to recharge the batteries, and you go in a country where you cannot do it. So try to understand what you could put in place instead of running, which kind of activity or which kind of things can help you. Another thing is to try to understand what are your red flags. When is too much? When I start to respond, my response are not as healthier as they were before. There are people that become irritable, people that sleep too much, people that don't sleep at all. So try to understand your usual functioning, and then what, in your opinion, or who could help you in case you need support. In places where ask for specialized help is highly stigmatized, you can research if there are, for example, peer support groups. There are groups of people that can actually gather together. Now online, everything is available, that can
Yeah.
have a sharing of this kind of experiences. What other people do when they feel that it's becoming too much? And then understand that we are not unbreakable, that there are limits linked to the fatigue, linked to the multiple exposure to traumatic events, because we are resilient. We build up also our capacity to react and function in very hostile environments. But where is the time limit for us? So we have to be tuned to our needs and understand what is good for us. Then really understand that we are not unbreakable, and seek for help when it's too much doesn't mean that we are crazy or we are weak. And as soon as you understand that your battery level is a bit low, better it is, in order to avoid to arrive at a point where the pain and the stress is really very high.
Um,
One other thing, sorry,
yeah, of
I have to
course.
say
Go ahead.
that
Yes.
physical exercise. Do not
Yeah.
underestimate the importance of physical exercise. It's the general well-being is functioning also in a body that is in movement. And also
I
we
was going
do,
actually to ask maybe the same advice could go for this. I was going to ask about working from homes. The pandemic forced all the people to work from home. Um, how this could affect the future of workers around the world. They of course somehow psychologically affected by this captured by being captured in homes. How this could affect their future.
well, again, how the future is affected depends on how you deal in when you are experiencing a certain distress. Um,
Do you have an
Lockdowns,
advice? Yeah, an
well,
advice, a piece of advice for them. Yes.
yeah, keep a routine. Certainly have a routine, and then really depends. What I know depends. I think that people can experience different difficulties. People, for example, that are live alone can be suddenly very isolated. Cannot go out, cannot have contact with the others, can enter in a spiral of more you are isolated, less you want to be in contact with the others. You don't dress for to work. You work at different hours. You don't eat normally. And people, for example, that were in lockdown and had to work with 3 children at home, and homeschooling. So different kind of stresses. Then overcrowded, suddenly our houses were overcrowded. So you can really have the extreme. What is important is to keep a routine, try to keep fit, have a lifestyle that is healthy, and try again to understand what do I need in order to feel better. I do not have one answer. Everybody can have a different answer, but try to understand what is make me feel good. People, for example, at the beginning of the pandemic, where a lot of countries were in lockdown, there were a lot of online activities. There were Zoom meetings, Zoom
Webinars, yeah.
aperitifs and parties, and yoga and dance lessons. Again, little things make your general well-being. We do not have one answer. Be tuned to what your body is telling you.
Back to MSF, we heard that MSF is about to launch a public communication package about mental moral distress. Um, if you want to tell us more about it, I know that it's not particularly for your desk, but give us like a reflection.
Yeah. So in MSF we have this unit that is researching and on the moral distress, and also the consequences that this can have on the life of the humanitarian. So it has created this package. First of all, was creating a space where the people can share this kind of experience. Be a safe and a confidential space where people can give a voice to this kind of internal strange things, and the people sometimes do not know how to translate. And they're also trying to find the strategies to prevent and alleviate the consequences of the moral distress. I do not think that we can erase the experience. We will probably always face in the humanitarian work a certain level of moral distress. How can we work on the consequences of it? So they are developing resources to support the staff in the field and one's home. And this also this communication package wants to raise awareness around this subject. Humanitarian workers are not superheroes, are not unbreakable. We have to be careful. We can do this job, and it's an amazing job. It's extremely rewarding, but can bring some challenging for our health. So we have to be careful, and we have also to talk about that. How difficult sometimes can be.
And how MSF is behind the moral distress. How dealing with such circumstances. Actually, MSF has a great knowledge about dealing with hard circumstances. Humanitarian workers, I mean, how they are exchanging their knowledge with other health workers who are dealing with such situations under the pandemic. I mean, is
Well,
there a
this is
way
an
of exchanging this knowledge, this accumulated knowledge during the presence of MSF in the field? How they are exchanging this experience with other health workers who are dealing with hard situations during the pandemic?
we participated to platforms where this is discussed, and in one sense, also this, in my opinion, is sharing our experience and our knowledge in order to bring our our experience and make it useful for other people. Also, because it's also this fact. Um, when I said we are not superheroes, people do not have to look at us as a such, and this can also be a bit dangerous. So we bring our experience, our medical knowledge in pandemics, in the field, how we manage emergencies, and then we also participate at platforms of different level.
um, I had I Let's start having questions from our audiences. There is a question here saying, so the image of superheroes harms more than it support the medical staff. What do you think?
It depends how a person is perceiving this. In the sense, if the others are looking at us as a superhero heroes, unbreakable, but we know that is not true, it's okay. We know our limits, we know when we have to slow down, we know when we need a break. If we do believe that we are unbreakable, that we can jump from a mission to another one, from a traumatic experience to another one, without listening to our body, listening to our mind, listening to our limits, this can be actually dangerous because we can arrive to a breaking point.
But if people around these superheroes are forcing them to act like superheroes.
I'm not sure how much people are forcing us to act as a superheroes or how much we believe we are. I'm not sure.
But yeah, but if so, how can someone who is under this situation could deal with it? How to make
Well,
people get back from him and make sure that he is not a superhero as they imagine?
well, the fact is we cannot brainwash people, with our talks, for example, when we discuss with people on of the challenges, of the difficulties that they could experience. And for me, it's also the point I ask to the people, what do you usually do when are you facing this kind of a complexity? It's more a dialogue, and try to make people understand that ha- to have limitations doesn't mean to be wrong. It's it's sometimes our body that when it's too tired is just not functioning anymore.
As a
It's
media person, actually, sometimes media itself, not even the people around the teams, contribute to this, to imagine that these humanitarian workers are superheroes, sometimes in a bad direction, actually, by creating sometimes stigma even. So how can we deal with this? How can humanitarian workers deal with this stress that the media do it sometimes?
I think at once that you are in the field and you are curing your patients, trying to bring humanitarian assistance, you see also the limitations of our intervention. We are rewarded from what we do, and we see the limitations. I think that we can mature as a humanitarian workers. We can give access. For example, what we are doing now, demystify, the fact that humanitarian workers are like journalists in war zones. Well, we do sometimes exceptional work. We put ourselves in conditions because we love this job, because we love the action, because we love to help the others. And sometimes when you come back home and you look behind, and say, "Wow, I did all that." But then we stay human being, and we know that unfortunately we do not have superpowers.
On the other hand, what would be your advice for the media workers when dealing with humanitarian works? Um, how can they be more supportive to this hard work that the humanitarian are doing?
Well, first of all, talking about what we do, talk about also the populations we are assisting, because this is also part of the humanitarian work. We often go and work in places in the world that are not very covered by the media, in forgotten wars, forgotten populations. Already talking about that is serving, in one sense, our cause. Talking about the difficulties that this can bring, but also the satisfactions, and I think also talk about our beneficiaries, because we are there for them. We are not there for ourselves. This is my personal opinion.
Yeah. Um, Let's see if we have more questions from the audiences. Not yet. Okay. We still don't have another questions from the audience, but let's have the chance for me to ask. Um, we have still like 15 minutes left. Um, my question would be about actually how far is the support given to workers in the field is giving fruits, from your opinion? Is it that much helpful, or those humanitarian workers need more? Is it sufficient, I mean?
It's it's hard to answer to your question. Probably it is never sufficient. Again, a good working environment is made by different factors. If we think about the humanitarian working environments, we could work more and have be sure that we have more rest, that we have enough human resources, that we are addressing the right needs from the right population. There are a lot of questions. We can just try to be tuned. Uh, for example, when I talk with the people when I come back from the field, I always ask to everybody, can I have your feedback on the general well-being of the team you worked in? What, in your opinion, are the needs? What we could do, in your opinion, to improve the support? And they are not necessarily medical people or psychologists. Anybody can have an opinion on that. So also try to be open and aware of the what is going on in the field, and try to adapt the answers and the support.
Actually, we have another question here about maybe a complete of my question. They are asking, has MSF increased the mental health activities in the past years? Do you
For
have a
the
development that is happening in this particular issue?
regarding the staff, I think yes. I do not have numbers, but regarding the support for the staff, this last pandemic, I think that put under the light the needs of support for the humanitarian workers. So yes, we put more means and more attention on a system that was just working, that was already in place.
So how you see the scale of offering this kind of services on the 50 years of MSF in the field?
Well, I really hope that that access to mental health professionals will be less stigmatized. I really hope that mental health will become a part of the health, because mental health is part of our health. Since we
Yeah.
have the physical health, the mental health, we make this, we force this division, but the individuals are one body, that is englobating also the mind. So I hope that in 50 years, this will just be one component and not the extra crazy one.
So let's finish our interview. I'm really happy and interested to have you today, Donatella. I would like
It's
to
very nice to be here.
thank you. Actually, let's end our interview with a sentence from you, wrapping up. What would be your what would be the takeaway that we all could have after this interview?
Can sounds banal, but take care of the carers.
Uh huh.
We cannot functioning well without taking care of ourselves.
Perfect. Thank you very much, Donatella.
You're very
It's
welcome.
been very pleasure to have you today, and we hope to have you again at another interview. Thank you very much.
Thank you too, Botaina, and thank you for giving space to this kind of discussions because this is helping us a lot. Thank you very much.
Thank you. Thank you. Bye bye.
Bye.